Well, hello and welcome to Rajat TV. You're watching India Fights Back with your host Rajat Kain, the show which gets you all the details about India's fight against COVID-19 pandemic. Well, today is International Day of Persons with Disabilities, the day that aims to promote the rights and well-being of persons with disabilities in all spheres of society. The day also aims to increase awareness of the situation of persons with disabilities in every aspect of life. And keeping in mind the prevailing COVID-19 pandemic, the United Nations has dedicated a theme, Building Back Better towards a disability inclusive, accessible and sustainable post-COVID-19 world. The theme attempts to understand the issues faced by disabled persons amid one of the most severe health crises in recent times. It's important to note that over 1 billion people, about 15% of world's population, have some form of disability. It's a staggering number, and an estimated 46% of old people aged 60 years and above are people with disabilities, and that unfortunately happens to be the most vulnerable lot in several developing and underdeveloped countries. So how has pandemic left persons with disabilities vulnerable, and what can we as a society do to address the issue? Well, to discuss more on this, we are joined with a very important panelist, Dr. M. Thomas Kishore. He is Additional Professor, Clinical Psychology, NIMHANS. Dr. Rajesh Malhotra, he is Head of Department of Orthopedics, AIIMS, and Ravinder Singh, he is Scientist, Non-Communicable Disease, ICMR. Well, thanks all of you for joining us. Well, Dr. Thomas Kishore, I would like to start with you, considering it's a larger issue and not just involving the medical science, but also society. How big is a problem that is being faced by disabled across the world? Let's for a moment keep the COVID-19 situation aside. We'll come to that later, but by and large, the challenges before people with disabilities and how we address it.
Namaskar. Thank you for this particular question. That COVID-19 is an unprecedented situation which we are all facing, and particularly people with disabilities are concerned. That we know as compared to people from other walks of life, and those who do not have health or disability problems, their problems are much more, compared to what we have. It begins with, first is that in the context of COVID-19, we are talking about certain precautions even before the vaccine and other things are in place, and they border on behavioral management, such as maintaining the social distance. Yeah, social distance is one, and then ensuring appropriate etiquettes in terms of hand washing and etiquettes of covering the nose and mouth while sneezing or coughing, and then hand sanitization, and lastly disinfecting the surfaces. These are the 4 things have been advocated, and to ensure that and to implement that, it requires a lot of effort, motivation on part of the people. So even when general population is struggling to understand the significance of this, then we can understand how it would impact people with disabilities also at the same time.
Right. Well, Dr. Rajesh Malhotra, let me come to you here. Sir, what as per the scientific approach, if we talk of, what are the most severe challenges that could perhaps be faced by the disabled people vis-a-vis the corona situation? Has corona left them even more vulnerable?
Absolutely. See, the impact of corona on the disabled people is actually multifold. It involves the disease per se, it involves the non-COVID issues as well, and it also affects their lifestyle, including the psyche, feeling apprehensive and insecure and having the mental issues. So talking about the medical issues, we know that many of these people are immunosuppressed, or they have illnesses and that makes them more susceptible to COVID infections. They get more severe illness, and they have higher death rate. So one thing is that their protection is absolutely important, because their outcomes are not as good as in the normal people, because they are living with suboptimal health. They already
Right.
have impairments, and that is the first issue. The second issue is that, the about the support. Now these people need support all the time. So what if somebody who needs a caregiver and goes into quarantine because he gets infected? Now somebody who can give him care can only be a COVID positive, or a person who will need constant supply of PPE and will need to invest in that. So they are again, they have special needs. That's what we need to understand. What about if they're in quarantine, how to get the proper supplies, which they might not be having access to. And I think it's a far greater job to do a good job of providing care to a disabled person who's at a higher risk as compared to a normal person.
Right, right, right. Well, let me go off to our ICMR representative. Well, sir, here, Dr. Ravinder Singh, sir, let me come to you here. We know that there is a vast amount of guidelines and procedures being laid out by the ministry, by the state, about the care of patients, about care of general public vis-a-vis COVID. Now, are there any specific guidelines about how to address persons with disabilities if they're down with COVID or any similar symptoms?
Yeah,
Dr. Ravinder
Namaskar.
Singh? Ji,
Yes,
namaskar.
yes. Namaskar. Yes, there are guidelines, and we mostly work along with the WHO, and they have brought in a lot of guidelines, and those guidelines talk of various aspects of care of person with disabilities. Say they talk about the health promotion part. They talk about the education part, health education of the person with disability and the caretakers. They talk about integrated mental health care, talk about providing specialty and allied health services. They talk about behavioral health services and
Right.
consultation. They talk about health technology, which are very, very important. And now we have also brought in national list of essential necessary products, and how to take care of all the health technology or health products, as they called. During this COVID-19 situation, we even went with certain, graphical representation of these devices,
Right.
and primary health care coordination among various specialties and referral services. Research and training is also very important. See, it's always ethical guidelines say that to do research for this kind of environment or pandemic situation is very, very important, because
Right.
this is the learning process which we are day in day out we are learning every day. And then health planning. How do we plan all the services at different level?
Right, right, right. That's a very valid point, sir, that what we do in terms of research and what we learn becomes reference point for what we have to do in the future. Well, that takes me to Dr. Thomas Kishore. Sir, let me ask you here, like, have you been getting any calls, or for that matter, like, has any the persons approached you, especially the persons having disabilities, for counseling as to how they cope up with the COVID cases? I mean, even
This
if
is
they're not down with COVID, I mean, are they like,
Yeah,
just to
yeah.
prepare themselves? Yeah, sir.
Yeah, this is such an important question. At NIMHANS, we have COVID helpline since February, as Government
Okay.
of India has given us a
Okay, okay.
mandate, as one of the premier organization in this area to offer tele helpline services. So in this context, we had received multiple calls on behalf of the caregivers particularly. And this we can segregate into several levels. One, we know that disabilities includes several categories, starting from physical, that is motor, then sensory, including visual, hearing, and then cognitive, that includes intellectual disabilities, autism spectrum disorders, and other developmental conditions. The main concerns that people had was how to educate people with developmental and intellectual disabilities and even autism spectrum disorders
Right,
about
right.
making them understand about three things. Again, I repeat, the social distancing, that as all of us, when we understand the importance of staying at a restricted places with certain precautions, we know why we need to do. But sometimes when the cognitive abilities are little slow or different, their level of comprehension is different, to make the child understand the importance of that was very challenging to them. How to manage that, I'll come back to that later.
Sure.
And second thing is that we also have come across children, and where the parents have reported to us that though the child knows that they have to wear the mask, but they cannot put it for long because they're sensitive to touch. It's very close to the nose, or sometime already, as sir was talking, in case if they have other coexisting health issues such as breathing difficulties, etc., to maintain that would be another difficulty. And the another significant impact that we have seen is that when the social opportunities were not there, in some of the children, I would not say all children with developmental disabilities, their problem behaviors have manifolded. They have increased because sometimes parents earlier they were dependent on the special education center, as Mr. Dr. Singh was talking about a while ago, and the therapists, all of them during this phase. Even the service providers were affected, and then people with disabilities were confined to home. The earlier services that were available to them no longer were there, and as a result, that even parents and families were having a double impact of managing this condition also. And the next one is, and how do we tell children to wash thoroughly? When we say that I need to adequately wash it, but a small child with maybe autism spectrum disorder or intellectual disability may not understand unless we concretely teach them. And this is where we had some of the adaptation of the techniques, which I'll be talking later, depending on the opportunity. These are some of the challenges. To sum it up, there was escalation in the problem behavior, number one. There are loss of opportunities for learning because they were not able to go back to schools or their therapy center, and at the same time transition to online activities that are available for children with neurotypical capacities
Right.
was very difficult for them. And on top of that, if they had pre-existing mental any other health conditions, which is very common in severe disabilities, their challenges were manifolded. So these were some of the things that we have seen. Yes. Yeah.
Right. Well, that's really staggering to hear. Like, Dr. Malhotra here, like, if we talk purely of the orthopedics here, if we narrow the scope of the disabilities here. So, in terms of orthopedics, are there any particular group of persons suffering from the orthopedics disability who are at more risk or more prone towards COVID-19, and what possible steps could be there for them to take?
So the people from orthopedic disorders who are particularly at risk are those who have conditions with weakness of the chest muscles, for example, where they cannot, they do not have enough lung reserve, and such patients are at high risk to get all the airborne infections or catch infection because they can't cough out the infective inoculum. If you have reduced mobility, then you are also actually prone to osteoporosis and the effect on the joints, particularly during the lockdown and all. If they have not been moving around much, so those with physical disabilities, if they regain or if they gain some weight, that also works to their disadvantage because then it becomes even more difficult for them to move around. We must remember that when we are talking about the managing these orthopedically handicapped people, there are three things we want to concentrate on. One is activities of daily living. So that if it starts getting affected, that is the one thing which is a primary thing that, they should preserve their level of activity and should be able to do activities of daily living without support as far as possible and have minimal support. The second will always be the disability specific assistance. Suppose somebody has an amputation and he cannot wear the prosthesis by himself. He needs some help there. Those kinds of things which may not be available because the family members are affected, or we also know that the disease itself leaves the patient totally drained and exhausted and very weak. A lot of patients complain of a lot of weakness. Will further aggravate their feeling of disability and inability to do something. And third, of course, is the protection and safety of these patients, because, like I said, anybody who's not mobile not only is at a risk of the orthopedic problems getting worse, but also will be at risk for other unrelated other systemic diseases like diabetes, hypertension, and all. So I think it needs a very comprehensive care for the orthopedic problems as well.
Well, sir, before I move on to other panelists, let me ask you one small question here. Sir, suppose like we have a patient here, or for that matter, persons who in the past have had a disease related to lungs, any pulmonary disease, say for instance, pneumonia or tuberculosis. So will that render them prone towards orthopedics disorder and perhaps further to COVID-19 pandemic as well?
Absolutely. You know, we have children who have got deformities of the spine. We call it scoliosis. We have the children who have the chest deformities, and like you said, the patient or arthritis like ankylosing spondylitis, where they can't expand their lungs much. So all these patients have very poor pulmonary reserve. They have very poor reserve of their lungs. You know, that's why we always see how much a person can expand his chest, because or how long he can hold his breath. These are the parameters. Now in the COVID times, we are also talking about a 6-minute walk. Like if you can walk for 6 minutes without getting breathless or losing the saturation levels or dipping your saturation levels, then those are the tests. Now somebody who's got a decreased lung capacity or reserve will actually be hit much harder by a disease which is primarily of the lungs like COVID, and then leave them at a much higher risk of complications, oxygen requirement, and even death.
Right, right. And that's very important information, sir. Well, let me come to you, Dr. Ravinder Singh here. We have some very alarming data here in terms of people suffering from disabilities. Well, 15% of world's population is disabled.
Yes.
Of that, 46%, well, that makes about 7 to 8% of world's population are 60 years and above people with having disabilities. So that happens to be the most vulnerable group. And considering it is a health crisis, and considering there are several underdeveloped or developing countries, what is that? How are we preparing, especially in the places where the health services are little more wanting than what we see in primarily urban areas?
See, what we currently are doing, and in future, very near future, what we are going to bring in the lot of changing in the care of person with disability. Not only disability, but we say functional impairments. So we have not only say 21 disability as per RPWD Act. We say that there are person with injuries, there are older persons, then person with mental illnesses, then there are person with increasing non-communicable diseases, person with gradual functional decline, and children with neurodevelopment disorder and learning disabilities. So these are the broad categories which need some sort of assistance or healthcare restructuring. So what we say that all these persons, as you said, that 42% of the older person, 46% older person, 15% of the general populations. But in India, we have been saying that it is 2.21% or something like that.
No, I was talking of the global population and their index that comes down to be 7 to 8%.
Now what we are doing now, as I shared earlier also, we have already prepared a list of essential assistive technologies. So which is a major factor for making them functional again. Almost every disease will cause some disability for some period of time. It's 1 or 2 or 3 days when patient is bedridden. But then the ultimate aim of health system is to make them functional, back to their work, back to their family, to their community. So that is where the role of assisted technologies is there, and we have already prepared, and even Niti Aayog has also shared a list of assisted technologies with Bureau of Indian Standard, where we are working on the standard of these technologies. So very shortly, we are going to bring in the lot of changes in the health structure. We are working on at what system, which kind of technology can be provided, even at the health and wellness center, then going up to primary health center, tertiary care, community healthcare, sub-divisional hospital, district hospital, super specialty hospital, medical colleges. So this is the structural little bit changes which you will see very shortly in the near future.
Right, right. Is there, sir, is there also a need to train society at large or part of population in handling?
Yeah,
Yeah. Please,
yeah,
sir. Please go ahead, sir.
yes. There is need to teach even the caretakers, society, and DPO has a major role to play. The disability person organizations or NGOs. So we have to reach them because they are the best contact with these persons. So health system cannot reach everywhere, but we can reach at least with DPOs and NGOs and caretakers, so that they are able to they are empowered and they are able to take care of these persons, these people with disability.
Right. Well, Dr. Thomas, as you just mentioned that you had NIMHANS had set up a COVID helpline, help desk way back in February itself. So if we, I know it's very difficult to segregate the data here, which among a group of people you found most vulnerable or perhaps little more wanting or requiring some sort of a counseling? The patient itself or the caregivers or the caretakers of the patients?
Yeah, I stand corrected because there are already official documents available from our institute, with the Minister of Health and Family Welfare. But it is very difficult, therefore, to single out at this point. One thing, since we are working in the area of mental health, primarily our clientele was, from the background of psychiatric illnesses and related issues. One. And as far as children are concerned, we had predominantly developmental disabilities, which include autism spectrum disorders, intellectual disabilities, and even ADHD, though it is not considered as one disability category. And a lot of parents and families had approached us that, pre-existing behavioral issues have risen during this phase. So as far as the demography is concerned, we have seen anywhere between 6 to 13 years age group where families had expressed a lot of concerns about their engagement, their behavioral issues, and also the caregivers' own stress, because earlier they used to go to offices. Now, since they are there, they also need to work extra time to engage the children. That was equally stressful for at least certain section of the parents.
Right. Absolutely. Well, before we just sign off, Dr. Rajesh Malhotra, last words from you. As we often see that whenever we have a pandemic or for that matter, health crisis, that as we saw in terms of swine flu in 2009 and later with chikungunya, that leaves, I mean, although we are able to fight the virus, but it leaves some sort of a residue in forms of the orthopedics disorder, or like we have pain in the bones or joints here and there. So are we looking at a similar thing once we actually fight back COVID-19?
Absolutely. Those who have been affected by COVID as well as those who have not been affected by the COVID but have been locked down will all have aggravation of the orthopedic problem. The biggest problem which we see now in the short term, I already briefly alluded to that, saying that the people have had so much of muscle pains and joint pains that they are unable to stand. Their bones have suffered, osteoporosis and all. But my biggest apprehension is that, some of these seriously sick patients who have received large doses of steroids, they may land up with us with the adverse effects of steroids on the bones and joints. One of them is the avascular necrosis, as we call, losing the blood supply to the ball of the hip joint. That is my biggest apprehension, but then that we'll cross that bridge when we reach there, because right now that is the only intervention we have for saving lives. But I do apprehend that it will mess up the bone biology as well as the blood supply to certain critical areas.
Right. Well, many thanks, Dr. Malhotra, Dr. Thomas, and Dr. Ravinder Singh for joining us and throwing light upon this extremely important issue. Along with that, also guiding all of us, everyone who's watching this show, as to how to do and what to do when we are confronted with this health pandemic? Well, before we sign off, it is a small appeal by RSTV to all our viewers. Please stay safe from coronavirus. Remember, wear a face mask, keep washing hands regularly, at least for 20 seconds, that's a guideline, and follow physical distance. These are 3 small things that is required to fight a pandemic. Stay safe, stay at home, stay healthy. Thank you.